Welcome to the respiratory section. In this chapter, the sections are nose, accessory sinuses, larynx, trachea and bronchi, and the lungs and pleura. On your exam, the respiratory section is split with the cardiovascular section. So you should have about 5 questions on respiratory and 5 questions on cardiovascular. The subsections for each section is incision, excision, introduction, removal of foreign body, repair, destruction, and endoscopy. Let's go over some of the terminology. Pneumono means lung, septo is nasal septum, plasty means repair, rhino, nose, synthesis, draw out fluid. So a rhinoplasty is a repair of the nose. You have accessory sinuses. Those are frontal, maxillary, ethmoid, and sphenoid. Accessory sinuses are lined with cells that make mucus to keep the nose from drying out during breathing. The frontal sinus is in the lower forehead. Your maxillary sinus is at your cheekbones. Your ethmoid sinus is beside the upper nose. And your sphenoid is behind the nose. This is a picture from the ICD-10 book. You will probably have one in your book as well. You definitely have one at the beginning of the respiratory section, where it shows the sphenoid, the maxillary, the ethmoid, and the frontal sinus. You should know that these sinuses are to provide mucus to moisturize your nose. That's their main function. Look at the turbinates on this picture. The turbinates are important structures in the nasal airway whose primary function is to warm and humidify the air we breathe in. There are 3 turbinates on each side of the nasal cavity, the superior, middle, and inferior, each with a slightly different function. This diagram shows your throat anatomy. You have your tongue, your mandible, which is your jaw, your hyoid bone, your thyroid cartilage, your trachea, your esophagus, vocal cords, epiglottis, lingual tonsil, soft palate, adenoid, inferior turbinate, superior turbinate, and middle turbinate. Tonsils and adenoids are the body's first line of defense as part of the immune system. They sample bacteria and viruses that enter the body through the mouth or nose, but they sometimes become infected. Let's talk a little bit more about the anatomy. The nose includes an external portion that forms part of the face and an internal portion called the nasal cavities. Then you have your larynx, located between your pharynx and your trachea. Another name for your larynx is your voice box. Your trachea is called your windpipe. There are bronchi. The bronchial tree is composed of bronchi, bronchioles, and the alveoli. The primary bronchi enter the lungs at a region called the hilum or hilus. Bronchioles are bronchi that divide into smaller tubes called bronchioles. Bronchioles regulate flow of air to the alveoli. The lungs have divisions or lobes. The right lung has 3 lobes and the left lung has 2 lobes. The right lung is larger and heavier than the left lung, but it is shorter and wider. The primary function of lungs is oxygenation of the blood. Now turn to the nose section of the respiratory section and look at the incision portion. In the incision section, you have drainage of abscess or hematoma. These are coded with 30000 and 30020. 30000 is for the nasal. 30020 is for the nasal septum, which is the middle portion of your nose that separates right from left. Now turn to the excision section. In the excision section, you have nasal polyps, which are growths of mucous membrane into the nasal cavity. They can be associated with chronic inflammation of the lining of the nasal passage and sinuses. Procedures for nasal polyp excision can be simple or extensive and may be bilateral, requiring the use of a 50 modifier. Be aware these codes are used for removal of one or multiple polyps due to the S in parentheses on the word polyps. When a description is listed with S in the parentheses, the code is reported one time regardless of how many follow-ups are removed. Excision or destruction of lesions in the nasal cavity are reported by the approach used. Remember, destruction is a surgical procedure wherein the physician uses techniques such as lasers, cryotherapy, or electrocautery to get rid of a lesion rather than cutting them out. There are codes to report cyst removal and turbinate excisions and resections. Turbinates are small, soft bones found in the nose, 3 on each side. Turbinates control the main airflow. When coding removal of the turbinate, the codes are reported per turbinate, not per side of the nose. You could end up reporting a total of 6 turbinate removals. Repair section of the nose. Rhino means nose, plasty means repair. So that is a repair of the nose, rhinoplasty. 30400 is reported when a primary plastic procedure is performed with lateral and alar cartilages and or elevation of the nasal tip. 30410 is used when a complete rhinoplasty is performed, when the bony pyramid is repaired. That's the key there. The bony pyramid is repaired. 30420 is reported when the primary plastic rhinoplasty is done with a major septal repair. And 30460 and 30462 is reported when a rhinoplasty is done for a nasal disformity due to cleft lip or palate. A septoplasty is a repair of the septum of your nose, and it is coded with 30520. Now turn to the sinus section. Remember, you have 4 sinuses. You have your maxillary, sphenoid, frontal, and ethmoid. The incision section has sinusotomy procedures. A sinusotomy of your maxillary is called an introtomy. Intranasal, that means inside the nose, is 31020. Radical without removal of follow-ups is 31030. Radical with removal of follow-ups is 31032. Sinusotomy of the sphenoid, you can code with or without biopsy 31050, or with removal of follow-ups or mucosal stripping 31051. Sinusotomy of your frontal sinus is external simple 31070. And lavage and cannulation of your maxillary sinus is 31000, and of your sphenoid sinus is 31002. Now let's look at the sinus endoscopy procedures. Sinusotomy is included and not coded separately with endoscopy procedures. You should write that note in this section. Go through and highlight the sinus that is in each code descriptor in this section so you don't get confused. Parenthetical statements in these codes require close attention, so you should read through all of those. Always read further ahead when there are parenthetical statements to help in choice of the correct code. Let's turn to your larynx section. In the excision section, you have a laryngectomy, and these procedures should be coded based on if the procedure was radical or not. And remember, radical is cancer. The goal of the procedure is to remove all tissue containing cancerous cells. Radical is to remove sternocleidomastoid mastoid muscle, submandibular salivary gland, internal jugular vein, lymph nodes of lateral neck, chin, and mandible, and also supraclavicular nodes. Now turn to the introduction section. Look at 31500. That is for emergency endotracheal intubation. A change of a tube via tracheotomy is 31502. When a phrase in a medical record states the patient was intubated, it is referring to an endotracheal intubation. When an emergency endotracheal intubation is performed, the person is unconscious. A tube is inserted through the mouth into the trachea with the help of a laryngoscope for that person to be able to breathe. In the laryngoscopy section, you have laryngoscopy, which includes examining the tongue base, larynx, and hypopharynx. Pay attention to parenthetical notes in this section. When coding a laryngoscopy, you should determine if it was direct or indirect. Direct procedures indicate the bronchoscope is inserted through the laryngoscope for visualization of anatomical structures. Indirect procedures mean the structures are viewed using a mirrored reflection. Now turn to your trachea section. Your trachea is your windpipe. A tracheotomy is an incision through the neck into the trachea to allow breathing. 31600 through 31610 are tracheotomy procedures. Do not use these codes for endotracheal intubation. The terms tracheotomy and tracheostomy are often used interchangeably. There is a specific code for revision of tracheostoma revision, 31613. A bronchoscopy can be performed through a tracheostomy, called tracheobronchoscopy. EBUS, or endobronchial ultrasound, can be performed in the case of malignancy, infections, and inflammatory diseases of the lungs. This is an add-on code. See 31654. Do not use this code with 31653. Look at CPT code 31628. The description is bronchoscopy with transbronchial lung biopsies. Note, this code is coded by lobe, not per biopsy. You should write a note next to that code. There is an add-on code 31632 that should be used for each additional lobe, not each additional biopsy. Now turn to the lungs and pleura section. A thoracotomy is an incision between two ribs, and it is to access the lung. Once the lung is accessed, a biopsy can be taken. Also, it is possible to explore the lung and pleura. Thoracotomies are typically performed to treat a lung abscess, lung cancer, or blebs. Blebs are balloon-like sacs pressing on the lung and are also called lung cysts. Pneumonostomy codes report incising into the lungs to drain an abscess or cyst. Now turn to the lungs and pleura section. The removal codes list pneumonectomy and resection codes. These codes address whether an entire lung or a single lobe or segment is removed, as well as if different resections are performed. The major types of lung surgery include a wedge resection, also called a segmentectomy, removal of small wedge-shaped piece of the lung, right wedge resection next to 32484. A lobectomy is a removal of an entire lobe of the lung. See codes 32480 and 32482. A pneumonectomy is the removal of the entire lung, 32440 through 32445. It's important that you know the difference in these three procedures. The introduction and removal section includes codes for insertion and removal of a pleural catheter, thoracostomy with tube placement, thoracocentesis, and procedures for pleural drainage. Remember, thoracocentesis is drawing out fluid. A tube thoracostomy can also be performed for pneumothorax or collapsed lung. You should write that next to there. Infection or persistent pleural infusion are other reasons it's performed. These procedures use larger tubes than used in performing a thoracocentesis. The diagnostic thoracoscopy code is selected based on the anatomic location being viewed and whether the biopsy is taken. A code may also be selected based on the abnormality being biopsied, whether it is a lung, infiltrate, or a nodule or mass. A surgical thoracoscopy is the code is chosen based on the procedure performed during the thoracoscopy. Turn to the lung transplantation section. There's 3 different steps to coding these. You have the harvesting of the lung, the backbench work, which is the preparing of that harvested material, and the insertion of the transplant. Harvesting is 32850. The first step is the harvesting. Live donors for lung transplants are rare, and only a lobe from one live person can be donated. Backbench work, 32855 through 32856, is usually a separate surgeon does this. In this procedure, the donated lung is prepared for transplantation into the recipient patient. You will select the backbench work code based on whether it is unilateral or bilateral. Lung transplant 32851 through 32854 is the insertion of the lung or lung lobes into the patient receiving the transplant. Make sure to review the instructional paragraphs regarding these 3 stages of lung transplantation in the CPT book. Now is the hemic and lymphatic system. This is found at the end of your cardiovascular section. The sections of this system are the spleen, general, transplantation, and lymph nodes. The lymphatic system is a network of lymphatic vessels that withdraws excess tissue fluid or lymph from the body fluid compartments, and it filters it through lymph nodes and returns the filtered fluid to the bloodstream. The spleen is a large vascular lymphatic organ lying in the upper part of the abdomen on the left side, and it acts as a blood filter. A splenectomy is the surgical removal of the spleen. Trauma to this part of the body is the primary indication for this procedure. Choice of code reported will depend on the approach. Was it open or was it diagnostic or was it endoscopic? That's what you need to answer. These codes are 38100 through 38102. A splenography 38115 is the suturing or repair of a ruptured spleen. Splenopexy is a synonym for splenography. You should write that next to this code. There is one code, and it is the same code even if a partial splenectomy is performed. Write splenopexy next to 38116. Bone marrow can be taken from a donor by aspiration from the sternum or from the iliac crest, which is the pelvic bone. Autologous is from the patient. Remember, auto means from themselves. Allo is the same as allograft. It is a transplantation between genetically non-identical individuals of the same species. See CPT codes 38204 through 38230. Lymph nodes are coded with 38300 through 38999. Lymph nodes are small glands filtering out harmful products. They also produce and store lymphocytes, which help fight infections due to bacteria and viruses. A lymphadenectomy, removal of lymph nodes or tissue, is what a lymphadenectomy is. This can be a critical component of staging a cancer. Staging helps the physician know the extent of the disease, and it is critical in determining a treatment plan. That's the end to the respiratory system. Make sure to study and take your exam. And remember, there should only be 5 to 6 questions on your actual board exam for this.